Hi there. My name is Marc DiFazio. I'm the Vice President of Ambulatory Services here at Children's National Hospital. I'd like to cover questions that you may have about the recent surges in clinical care that we've been seeing in our primary care centers, as well as the emergency department at Children's National. So the first question is, why is there a surge? And a secondary question is, how crowded are the primary care locations compared to normal times? So the first question, I think, is fairly straightforward. We believe that there's a surge for a few different reasons. The first is that there's a variant of COVID-19 that is more infective, meaning it spreads more readily amongst the population. So we're seeing more spread because of it more infectious. And then, of course, not everybody's vaccinated, including young children or people who have chosen not to become vaccinated. And then some of our important public health initiatives like mask wearing, unfortunately, have become a little bit politicized. And so some people have decided not to wear masks. So those simple measures, if not done all the time by enough people, will increase the number of people who are spreading the condition. Now, if we refer to surge as the number of children and adults with illness, the other reason for that is that we're beginning to get back to in-person activities. Many children have gone back to school. So we're also seeing a spread in other conditions, not COVID-19, other illnesses that have come out, and because children are together again. And as a result, some of those symptoms may be similar to a mild case of COVID-19. For instance, I may have a runny nose or a cough or some fever even. And as a result, primary care clinicians are being asked, can you determine, doctor, if this is a COVID-19 case? And if it's not, can I go back to school, or when can I go back to school? So our primary care providers are really fairly busy right now compared to a normal September in the United States. Typically, this would be a quiet time after the summer. And then as we enter the cold and flu season later in the season, in fall and winter, we would begin to see an increase in those volumes. Right now, we're dealing with a lot of the volumes that we would normally see at that time. So our primary care practices are very, very busy. The next question is, when is it necessary to get my vaccinated child a COVID test? So I just want to make sure everybody understands, we know that children above the age of 12 many have received the vaccine safely, and we are preparing for vaccinations for children 6 to 12 years of age, and that's coming fairly soon, which we're very excited about. But for those children and adolescents who have received a vaccine and are experiencing, especially, let me back up, if they have a pre-existing illness that puts them at risk for more consequential COVID illness, such as a severe lung condition, for instance, then those individuals who begin to have symptoms that might represent COVID-19 should be tested. Additionally, we understand that schools and other activities require a note from a clinician saying that my child who has been having these symptoms and wants to come back to school, for instance, a runny nose because of allergy, that child has been tested and has been cleared for the condition. So we do understand that there's pressures put on families by some of these organizations that may not necessarily be what your doctor might recommend. So in those situations where we're really trying to determine if we're dealing with COVID and a child who might be at greater risk, even though they're vaccinated, or if they've been vaccinated, but they're beginning to have other symptoms that might be related to another virus, that type of thing, oftentimes there will be a mandate for for a test in that situation. Next question, my child is too young to be vaccinated. Should I get them tested every time there's a positive case at school? No, the child doesn't need to be tested each and every time that there's a potential a case within the entirety of a school system. And truth be told, even if there's a close exposure, there's not necessarily the need to be tested. typically what we would do in that circumstance. If it was a high risk, we might do some testing for that individual. But if they're asymptomatic, we might ask them to self-isolate on the basis of probable infection given their close exposure to that individual. Sometimes going back to school, though, in that individual will require a negative test. But each and every time there's a positive test at school, the child doesn't necessarily need to go out and get tested. Really would depend on the proximity, meaning how close we were to that individual, how long we spent in the same space, and again, that child, meaning your child's underlying cause that might put them at greater risk for the condition. So the next question is a really good question. Once 5 to 11-year-old individuals are approved, where will I be able to get my child vaccinated? So there will most likely be wide community availability of the Pfizer vaccine for children of this age. And so most care providers, because of the overburdening of our organizations across the entire country and the world at this point, really encourage you to utilize some of those other resources. If you have a special concern about receiving a vaccine outside of your doctor's office or outside of a hospital setting or a healthcare setting, certainly you can run that by some of the doctors and nurses at that location to ask them if they felt it would be safe. But in almost all circumstances, it would be a very safe practice to get the child expeditiously vaccinated in their community, close to their home, where it's most convenient and most easy to get it done quickly, rather than waiting a long time for instance, a large vaccine activity, if that resource is close to home and is available. What are providers doing to prepare for the increase in patients? And I do think this is also a very important question, because it has affected a lot of my team members in ambulatory services here at Children's National, but again, around the country and around the world. So many things that we're doing have been focusing on, making sure that we can facilitate care, not just for COVID, but for children with all healthcare needs, and making sure, for instance, that we maintain safety in the clinical setting. And what I mean by that is, for instance, if we have a cluster of sick children, maybe putting them at a particular time of the day, so sick visits and clustering those together versus well child visits. Some well child visits may need to be put off depending on the degree of volume and the increase in clinical activity. And then other efficiencies that we've been introducing, and many other practices like this have been introduced around the country. For instance, if testing is done, offering an automated response or communication to families, whether it's by text or by email, saying your test is negative, and really working closely with local government, both in DC, for instance, for us in Maryland, Virginia, helping the school systems understand that should be sufficient. I've seen my doctor, she said I had a negative test. Here's my test result on my phone, or here's my test result in my email, and I'm going to print that out and give it to you. So we really do believe that some of those efficiencies have helped greatly, and actually probably will be very helpful for us going forward into the future, where we'll probably have similar needs, even if it's not COVID related. There are many reasons to seek medical care. So I guess I would be a little cautious about this. If you say that my child is ill and needs an appointment quickly, your first focus should be on seeking care where you normally get care, where your medical home is, and your pediatrician or the nurse practitioner, for instance, that works at that practice would be able to see your child for a sick visit, and that's probably where you should start. If your child's symptoms are relatively mild and don't necessarily need to be seen in a doctor's office, but there can be some interaction with the office, for instance, a nurse triage line, that's also another resource, and that nurse can help with your decision making as far as where to go or if an appointment is needed. Of course, at any moment, if there's a real concern about a serious safety risk related to illness of any sort, then either calling emergency medical services or going directly to the emergency room would be the first and foremost plan that you should have in place. So once again, thank you so much, everyone, for your attention. I hope I've answered some important questions for you. I do want to make sure that you understand that we have a COVID hotline here at Children's National as a potential resource as well. So if I haven't answered all of your questions, there are many such activities and resources for you in the community. And again, a reminder, your pediatrician's office is a wonderful resource as well. So thanks for your attention, and everybody stay safe.